Namaskar, I'm Ashok Vyas, and today in Wide Angle with Ashok Vyas, we are talking about wide range of that space which connects appearance with disappearance. And when I say disappearance with a smile, then it is difficult to make out that I'm talking about that opposite side of life where we stop seeing a person the way we are used to seeing him or her. And that could be devastating for the family, and we thought that we won't be around one day. When it approaches us, we try to shun it away. But there are people who are aware, and people around them are also aware that there is something which is taking place in them which is sucking away the force of life. It could be due to some disease that they have already detected, and in spite of all the medical facilities that we have at our hand, there are times when medicine can only help up to this extent. And also, let me recollect with you, even if medicine helps you, we have not seen anybody here for all the times to come, generation after generation. There is a recycle process that the nature has given to us, which takes place. Now the thing is, we learn more and more about life, and we want to be helpful to one another. And from that point of view, I am delighted to be welcoming someone who at young age, having taken up medicine as her profession, also thought deeply about in what way she could be of help in that phase of life when the transition is to take place. And I take this opportunity of welcoming Nivedita Agarwal. Nivedita, you welcome.
Thank
and
you.
Nivedita is inpatient medicine attending clinical instructor of medicine, and she is working with Santa Clara Valley Medical Center. And while she is visiting here, she decided to talk to us about this passionate subject which is drawing her attention. So let me first of all ask you, when you become a doctor, you are dealing with life, or you are also becoming more aware of death?
Both, they both go hand in hand at the same time. And you learn about life and you learn about death. I have seen a lot in front of me where I have seen patients that I have taken care of for days, and in front of me, those patients have taken their last breath, where I have held their hands at the last moments of their lives.
So I know it must be difficult, but if I ask you to recollect the moment when first time you experienced that there was life in this body and there is no life in this body, so how that affected you as a physician and as a human being?
It was actually a very heartfelt moment for me, because I knew that person. That was, I would say, in my training years. It was my first year of residency. And when I first encountered a patient like that, he had an interstitial pulmonary fibrosis problem, and that's an uncurable problem. He was towards the end stage of it. And I remember I was taking care of this patient for many, many days, many weeks actually. And I remember when I was there, when our entire family was there, and I was there with that patient when he was taking his last breath. And it was a very numbing experience, because I was interacting with him on a daily basis, where he was offering me seized candies. And, it just makes you realize that you live for those moments, and every moment matters, and you have to make every moment count.
Every moment should count, definitely. And when we look at life, and we're talking about this particular phase of life, so as a physician, how do you feel there is something other than medical knowledge that you can offer to say the patient directly, or something which if is a part of the consciousness or awareness of people, family members of the patient would be helpful?
So whenever I am talking to my patients, I talk to them as my own family members. When I'm looking at the patient, I look at him as my father or my grandfather. And when I approach my patients in that manner, I treat them as my family, and I advise what I would do if it was my father or my grandfather laying over there. I use that approach, and it makes a more personal experience for myself and as for the patient and the family as well. And it helps me and helps them connect to me on a more intimate level, and where I'm able to guide them of how to go about going further from this point onwards. And
so I'm sort of impatient in trying to understand. You yourself have a sense of helplessness as a physician. So in what way you can say something, or you can guide them, talking about family members, in how to face, if sometimes people are aware that they are going to lose their favorite person, and doctor is constantly in touch with them, but anything, I'm trying to understand what can be significant in terms of changing the way they would perceive it.
Sorry, I'm not.
The question relates to what is the additional help that you can provide.
Absolutely. So, when patients and families are at this juncture of life, we offer palliative care and hospice care support to such patients. And palliative care is specialized care that integrates multiple disciplinary approach. It utilizes physicians, specialized nursing staff, spiritual workers, chaplains, spiritual leaders, social workers, case managers, and all the physicians that have been on board with the patient's care, including the radiologist, oncologist, surgeons, cardiologists, depending on what the problem, what the illness patient has. We integrate the entire system together to kind of help patients understand what their prognosis is, what the treatment options are, and how we could individualize their personal and unique goals that are individual and unique to the patient themselves. Everybody has different goals, different life expectancy, and once a person is diagnosed with a terminal illness, and terminal illness is not only cancers, it can be end-stage lung disease, liver disease, kidney disease, heart failure, severe heart failure, where patients are not candidates for transplant. Or they have these like really severe chronic conditions. So we utilize the service of palliative care, and we offer them this support. So through that, we could bring the entire family and the patient together, and we could work on helping them anticipate, prevent, and manage their suffering and improve their quality of life. So the whole goal is to improve the quality of life of a patient and the family, while for whatever time they have remaining, they could actually live their life to the fullest potential.
So that sounds quite interesting from one point of view, because many of us are not aware about palliative care. Now the question is, who decides that this person or this patient is due for palliative care, and this decision is made in consultation with the patient or patient's family members. Three, since we are in America or wherever we are, the medical insurance also plays an important role in the kind of medical care that is therefore offered. So is palliative care covered by most of the medical insurance companies?
Absolutely. So very good questions that you have just asked me. So palliative care is offered by the primary physicians that are taking care of the patient in the hospital. So for example, myself, I'm an inpatient hospital medicine physician, and I'm taking care of the patient while they're here with me. And when I realized, including the multiple other physicians that are involved in patients' care, say we find a patient, who we just diagnosed with terminal colon cancer, and the oncologist is saying, okay, these are the treatment options for the patient, whether it's curative or whether it's supportive to prolong the patient's life. So those options are offered to the patient, and I could call the palliative care team at that time, or myself. Some hospitals have the palliative care specialty, and many hospitals don't have the palliative care specialty. So we use the same approach, and we offer the services to the patient and families. So that's the first question. The second one you asked me is whether the insurance covers it. So palliative care, is covered is covered just as similarly as other services are covered while the patient is in the hospital, but it's also covered by the insurances once the patient is discharged as well. As an outpatient, we give referral to oncology or radiation oncology or surgeons. We give that referral to a palliative care physician as well. And
so let's move to the other word, which is also kind of parallel in terms of its meaning, hospice and palliative. So what is the difference between these two?
Absolutely. So another very good question. So palliative care is offered at the time of the diagnosis, and it could continue throughout the treatment course or throughout the illness, whether the illness is curative or whether a patient is getting management to just prolong the dying and prolong the illness. Hospice care is offered only when the patient has life expectancy of less than 6 months. That's the only time hospice care is offered, when all the curative treatment options have been exhausted and there's no other resources over there. That's when we offer hospice care to, again, affirm life and accept death as a natural dying process.
So there are many Indian American physicians here in America. There are many Indian Americans also who would, of course, be reaching to the stage where they may need palliative care. But the system as a whole is not designed with cultural sensitive understanding of the patient if he is coming from India, in terms of if I bring to your attention, with each culture or each religion, there are different ways in which, as you were mentioning about chaplain, so chaplain is a term that connects with someone who is religiously profound and knowledgeable. So from that point of view, what has been your experience? Is palliative care available with cultural sensitive needs?
Yes, absolutely it is. So they actually take that into consideration, and if our patients are from India, Indian background, or Hindu or Muslim or any background, they try to get those kind of priests from that cultural background that patient will feel more comfortable with their language. They try to have as much support from the patient's the people from the same language that they speak, and the same cultural viewpoints that they try to incorporate when they're taking care of such patients.
So I'm talking to Dr. Nivedita Agarwal, and she has found this space worth having a dialogue about, where one is almost due to transit to another form, which is not the form of life. So what we are talking about is how to prepare and what way system offers certain supportive tools to take care of the patient as well as his friends and family members. So we talked about palliative care, we talked about hospice. In this context, if I think loudly, the patients are normally not in the mood to communicate. They, if are struggling to even have bare minimum communication because of the lack of energy, or sometimes mentally they don't feel inclined to communicate. So, in your personal experience of having witnessed somebody in that phase, does palliative care mean anything for the patient? Because he's not interested in anything, let us assume.
Absolutely. Again, a very good question that you just asked. So that's why it's very advisable for for everybody, to have advanced directives and advanced care planning. Advanced care planning basically incorporates, it's a legal document which is composed of a living will and durable power of attorney. So a living will basically means, if in case a person is not able to make decisions for themselves, what kind of treatments they would want for themselves, which may include life supportive treatments such as DNR, which means do not resuscitate, do not intubate, CPR, wanting to have a mechanical ventilation done or not, dialysis, surgery, medications, IV fluids, IV antibiotics, what kind of food they would want, if they would want to be fed or not. So that's a part of living will. And you could write all these things down in the living will, what you would want, what you won't want, in case if you have a terminal illness where you won't be able to gain back yourself permanently. Second part of it is durable power of attorney, which is legally designating a person who could speak on your behalf if you are unable to do so. And this person has to be above 18 years of age. This person has to be someone who's very close to and will be readily available for you in times of, especially in these times. And this person should be aware of your values, your beliefs, what you would have wanted if you were able to make such decisions. This person could make decisions on withdrawing any kind of life-saving treatments on your behalf, or continuing the life supportive treatments. This person could make decisions about any kind of surgical procedures, medications, IV fluids, tube feeding. So very important person that you designate.
Please repeat, what is this document that you...
It's called Advanced Directives. And any of us, we all, like any adult, should have these advanced directives in place, so that...
So that is even when you do not have any terminal illness, should you sign it before
absolutely. That? And this is only like,
and how do you, sorry to interrupt you, how do you go about it? I mean, first of all, if you are not feeling that you are anywhere close to that situation, then you are thinking about having this kind of document, considering to sign it, it sounds absurd when you are perfectly fine. Plus the person who is going to sign on for you, whether she or he, they would also discourage, they will say that why think so negatively about yourself.
Absolutely.
So how do you respond?
Absolutely. So, anything could happen in life, and these advanced directives are for anyone that is a healthy person. It's not in the terminal, it's not for, you should not sign it only when you're in terminal stages. It's for you and I.
So where do we find this document?
So your primary care provider could actually provide you with these documents. You could go to a law office also, but primary care providers, hospitals, everybody carries these documents, and you could fill them out.
Do you see a lot of people signing it? Are people aware of it?
Yes, absolutely. Quite a lot of people are aware of it, but in many communities, it's not talked about, because just like you mentioned, it's very absurd for us to actually have such thing. So I'll give you an example, right? So say today I'm going somewhere, right? I get into a major car accident. I would want everything to be done for me, every single thing possible, CPR, intubation, everything, if there's a chance for me to revive back to my normal self, right? After all the attempts have been made and I go into a chronic coma-like state where which is called permanently unconscious state, where I have no chance of coming back to life. And so we have families, when they have such patients, such family members, they go on it. They go on mechanical intubation for 30 days, 2 months, 3 months, and patient goes into anoxic brain injury where their brain is completely gone, and they're not, they won't be coming back to life any further. But these patients are chronically ventilated because they did not have advanced directives in place, and this is when these advanced directives come handy, because would you want yourself to be chronically intubated and kept alive on a machine, or would you want to let go comfortably? And that's when these decisions are made. So it's really, you want to try everything to revive you back, but when you can't do that, when all the efforts have been made and you are in the state where nothing can be done further, what you would want at that moment.
So I would, in other way, say that this is a kind of will on your behalf about how your body should be treated if you're not in a position to consciously decide as to which way to go. Some people are end up in coma for a number of days or months, and do they want to continue to be in that stage or not? If they can foresee that and convey that to someone, otherwise maybe their family members need to make that decision. That's how it happens many times. But I really appreciate you taking the trouble and what should I use the word? It is your compassion, in addition of being a physician, that inspires you to share all these details, because I'm sure many of our viewers probably might have not heard about advanced directive earlier, and there is a document that you can sign, etc. We wouldn't like anyone who's watching to be in that stage, but it is good to be aware of what is out there. And from that point of view, as we conclude this conversation, once again thanking you. Anything in particular that in 30 seconds you may want to repeat that you have already said, or something that you want to add?
Absolutely. I would like all my viewers to start the conversations with their family members. I want them to come together, talk about these things, talk about their fears, what they would want if these kind of situations occur or when they occur. I want families to enjoy the moments together, to come together as one and enjoy and make every moment the everlasting moment, because this is all we have. Once we're here, we're here. Once we're gone, we're gone. So make every moment the everlasting one.
Make every moment everlasting one, and once we are gone from the show, we can come back, so don't worry about that. And indeed, those who are not with us, whether in our family, my family, or your family, we pay our tributes, as well as we pray for the peace to their soul. And I am aware that there are some deep emotional connections that are in the heart of Dr. Nivedita from her family members, which has also been a guiding force for her to be spokesperson for anyone who is out there in this situation. I request you to mention names of your...
Sure. My grandfather, Mr. Krishnakant Agarwal, he passed from pancreatic cancer. My grandmother, Mulvati Agarwal, she passed from stroke. My another grandmother, my maternal grandmother, Mrs. Indira Agarwal, she also recently passed from stroke. My maternal grandfather, Mr. Narendra Kumar Agarwal, he passed from Alzheimer's dementia. And my uncle, my Mamaji, he passed, Mr. Sri Krishna Agarwal, he passed recently from acute respiratory distress syndrome. And 2 of my cousins passed a few years ago in an accident, Naveen and Sachin.
So I'm sorry to be sharing this fact that all of us have experienced this, and each one of us remember them with love, with respect, and there's a continuity of life, and the essence is this body goes, but you're always there. So what we said is a reminder that this moment that you have, it is golden, it is precious, and the most valuable gift that we have. So may we live to our fullest potential, and I thank Dr. Nivedita, for bringing this awareness to our active consciousness once again with lots of good wishes.
Thank you.
Thanks for watching. This is Ashok Vyas.